Professor Sharon Lewin, let me put this to you because we have been overwhelmed with questions from people across the country wanting to know whether kids should be in school, whether they shouldn't be in school. What is your view?
It's a difficult question, and you can see there's great divisions in what experts are saying. And whenever you have a division in what experts are saying, is because the reason is because there is no clear answer. There's pros and there's cons of keeping schools open, and I'll talk about some of the pros, and then I'll talk about some of the cons. I guess first of all, we know that children do not get very unwell with COVID-19. We certainly know that children can get COVID-19 and can spread it, and that they can do it when they're asymptomatic, meaning that they've got absolutely no symptoms. And so therefore there's this worry that you're going to get spread and there's going to be taking the COVID-19 home. So there's a number and we know that influenza, for example, schools are a great source of virus and spread within the community. So we look often to other countries and see what other countries did and whether that was necessary factor in the response of closing schools or not. There are some countries that did close schools, such as China, other countries that didn't close schools and had a fairly successful response, such as Singapore.
But Singapore did very different things to us, though, didn't they?
They did indeed.
They took temperatures to every student as they arrived. They took temperatures multiple times a day. Taiwan is the same. Are we right to compare our situation to Singapore on that front when we're not actually doing the same things?
I'm just using it as one example of why there's confusion, so that I'm not using it as a direct copy. I'm just using an example of why there's confusion. So you see some countries that do well that have kept the schools open, and some countries that do well have closed the schools. So therefore there's a question of how important is school closure. That's why I've brought up school closure. The big issue about closing schools are all the other impacts of closing schools, and the person that asked the question raised that very well about mental health and education, etc. And finally, big impact on the workforce if you close schools, particularly healthcare workers, which are so essential to our response. So in making this decision, we're weighing up all these factors of risk to the community and also teachers, of course, occupying the workforce, and whether how essential it is or isn't. So I see it, closing schools or not, as a package of interventions. It certainly will increase social distancing. What we're trying to do is reduce the risk of people being exposed to the virus. The less contact we all have with each other reduces the risk. So the question then is, do you do everything to try and reduce the risk to nothing? And we all do want to reduce the risk to nothing. Or do you make some compromises in some settings because there are payoffs with this extreme social distancing? And that's the sort of thinking that's going through. For me, I'm a bit pragmatic at the moment. I think we're in it's a really important time for Australia to get it right, because although we have escalating numbers of cases, we actually have relatively few cases currently, and we've been testing quite intensively since the beginning, since our first case in the end of January. So now is a really important time to get it right, and therefore I think I would err on the side of going a little bit harder now in this precious time we have to stop an escalation of infection. So I would err on closing schools. We're coming up to the Easter break. It's quite a pragmatic move, but I was explaining the reason why it's not black or white.
Paul Kelly, is it still your advice in your position that we shouldn't close schools?
Yes, and I, as Sharon says, I see the counter-argument. My sister's a teacher. I know that it's a struggle for her every day, and I mentioned in a press conference last week that she'd been abused by parents about hygiene and so forth in the schools, and that's just not on, by the way. We all need to be working together. We can't be going around abusing teachers, healthcare workers and people in shopping in grocery shops. But in terms of schools, this is what we know about this virus, and we're learning more every day, and we give that information every day to the public. First of all, this is not flu. Everywhere where the virus has spread, around about somewhere between 1% and 3% of the cases are in school-aged children. That's very different to flu, where children are super spreaders usually. They're the ones that are often spreading the virus and sometimes get extremely sick. There was a paper published over the weekend which very in some detail demonstrated what had happened in Hubei province in terms of children. Those that got sick, again, very small proportion, about 2.4% of the total cases were children under 15. Only a third of those were 15% were asymptomatic, and about the same number had very mild illness, just upper respiratory tract infection. And only one child, unfortunately, died, but that was very, very low numbers. Second of all of those cases, and this is what has been found in other countries, tend to have come from the parents and not amongst children. Again, very different to flu. And then there's all the effects that Sharon's gone into. I won't repeat them. But closing schools is a big thing. And what we've been trying to do right throughout this is to look at proportionate responses, what actually needs to be done now, thinking of that long-term game, what is sustainable over the long term. This is not a 2 or 4 week thing. If schools close, they are closed for at least the next 6 months, probably for the whole school year. That is a big thing for people like the person that asked the question, who are coming into their final year of school. That is a life-changing event. We can't make these decisions lightly, and they may have a place at some point. Some people that feel that point is now. I and my colleagues on the Australian Health Protection Committee disagree.
Let's just put this in perspective. So what we've got in Australia is an only partially targeted testing campaign. We're missing asymptomatics. And so we don't have the best possible, it's not about numbers and gross numbers with testing. We've got an inadequate testing regime. We've got an inadequate quarantine regime, which relies on trust. It is changing a bit in some states. And therefore, we're not actually under control. And the hockey stick illustrates that. So it's doubling every 2 or 3 days. So you get a year 7 primary school student, and Sharon's right, it's lower numbers now. We've got a chance now to get it under control. Now, when you've got not an adequate testing regime and you've not got an adequate quarantine regime, what's left to us is social distancing. And all the mathematical modelling, including it comes out of Sharon's group, tells you that social distancing is what makes a difference. And you've got to put the foot on the brake harder on social distancing if you're not doing the other stuff well.
So if that's the case, Paul Kelly, I know you have your own modellers. Do the numbers that you are seeing show that by shutting schools now, you will do more to flatten this curve?
So school closure is one of our potential things we can do. It's in our plan, and we've been very open about that as something we would consider at some point.
Sure, but with respect, that's just a very straightforward question about whether your modelling shows that by closing the schools, the curve would flatten. Does it show that?
So this goes to Sharon's point as well. When you have a range of interventions, it's hard to know which one would work the best.
But the modelling from London's clear, Paul, that it's not the magic pudding here, but each time you put your foot on the brake, you get a greater flattening of the curve. And the Imperial College London group found that, in fact, closing schools in their model, and they're some of the best modellers in the world, actually had the biggest effect. And it's a terribly difficult decision. I mean, it's just an appalling decision to have to make. But they showed that it was the biggest thing you could do to make a difference to the curve.